Tips for becoming a dentist, certainly you want to make sure that you kind of immerse yourself in a situation where you're being exposed to that. It's one of those things that, if you read about it and you see a little bit about it, that's one thing, but to actually be interacting with the dentist, sitting down with the patient and watching things, that's the biggest tip I would say, is making sure that you observe, the practices that a dentist do, because it's one thing when you see it in a book, but when you see it live, it can certainly change your perception of how you perceive dentistry. So certainly, getting to know a dentist, kind of seeing what they do, that's one, and obviously another tip would be, it's very hard to get into dental school nowadays, so from an academic standpoint, you have to be academically strong, so you need to do well in your prerequisite courses that you need to get into school, and certainly, there's an admissions test, and they look on that very highly, and that's very important you do well on that test. But for me, the three biggest things I see is, doing well on the placement test, basically making good grades, having a good grade point average, and certainly getting the exposure that you need to make sure that you make the right decision. As far as learning on the job, I think, learning to be compassionate and understanding and trying to help the patient, understand what they need, because again, dentistry can sometimes be a very complicated, mysterious, ambiguous thing to a patient. So a pearl of wisdom is being able to be compassionate and understanding, and then being able to translate it into a way that the patient can identify with and recognize and understand. That to me is very, very important, because whether or not you're the best technically skilled dentist or not, I think your interpersonal skills are just as important, if not more important, because the patient basically needs to sit there and make sure that they understand and feel, not only have compassion towards them, but be, understanding and willing to know that whatever you tell them isn't going to be put off in a way that's, putting them down. Certainly one of the biggest challenges is, again, trying to deal with patients that are indifferent and don't want to come. Too often times we deal with patients that come in, they don't want to be there to begin with, so either someone took them in there or pain brought them in there, and it's trying to deal with the patients that don't want to be there. That is certainly a big obstacle, and a lot of it, again, has to do with being able to hear the patient out and understanding where they're coming from, and learning how to be empathetic so that the patient can be comfortable with you doing whatever it is that you recommend. So again, I think dealing with the patient, difficult patients, that can be a very big obstacle, and certainly trying to make sure that people maintain adequate care of their mouth so that you're not always working in emergency situations.